Good afternoon, and thank you for all of you being with us here today on Monday. It has been, I believe, since the middle of last week since we did a briefing from this room. On Friday, I did do an event in the Harrison County Emergency Operations Center. Ely and I both spent most of the weekend on the Mississippi Gulf Coast. We visited EOCs in Jackson County, Hancock County, and Harrison County, met with local elected officials there. Obviously, Friday was June the 5th, day 5 of hurricane season, and we were on our third named storm of 2020. And so we monitored the storm throughout the weekend from the Mississippi Gulf Coast. And Director Michelle will give you a more complete update. But what we have found over the last 24 to 36 hours is while this particular storm was not nearly as large as many as we have seen in the past. It was not nearly as strong as many as we have seen in the past. It was a serious storm, and in many instances, the people that I spoke with on the Gulf Coast believed that it was actually, it brought heavier winds and higher water than they originally anticipated, given what they had seen in the 3 or 4 days leading up to landfall. The actual tropical storm / tropical depression made landfall slightly west of the Louisiana-Mississippi border. Earlier this morning, we had 17,000 households in Mississippi without power. The maximum wind speeds that were recorded were near 50 miles an hour. We did have 3 shelters open throughout our state, much of which was in southwest Mississippi, but we only had 1 reported household that was displaced. We did not, earlier today when I received my briefing, at that point we did not have any fatalities in Mississippi, nor did we have any reported injuries early this morning. And so, again, we still have threats that remain in our state. We have increased risk of thunderstorms. Because of those thunderstorms and because of the rain that we have seen throughout our state, flash flooding remains very possible. And in addition to that, as these outer bands of this particular storm moves through our state, tornadoes remain very, very, very possible. So we want to remind everyone to stay weather aware. That is critically important, that everyone stay weather aware. And hopefully we'll get the vast majority of crystable outside of our state, hopefully by later this evening or early in the morning. Now I'll switch gears and talk to you a little bit about COVID-19. I understand that if you watch cable TV or you watch any other TV or in large part watch any news, that you might be led to believe that the coronavirus and COVID-19 is over. Many of the cable news networks have moved on to something else. But I'm here to tell you that in our state, COVID-19 is not over. Dr. Dobbs and I spent this morning on the phone with supervisors and mayors across our state, urging them to stay in the fight, encouraging them to continue to be very vigilant in their efforts on COVID-19, because we are continuing to see cases in our state. If you look at the date of onset of illness, what we've seen in the last 3 weeks of May is that our peaks have been relatively constant and maybe slightly up in those last 3 weeks of May, and our valleys have been slightly up as well. And so we know that we've got to remain diligent in our preparation. Just this morning, we reported 498 new cases of COVID-19. Admittedly, some of that was probably the cumulative information over the last week as we put data together. In recent days, we had 236, 265, 209, and 238, but our rolling 7-day average remains in the high 200s. We are reporting 20 new deaths, and so we are continuing to see those effects. In Mississippi, we have 17,768 total cases, 13,356 recoveries. I say that simply to remind you that we have over 4,000 active cases in Mississippi today. We have to remain vigilant. We have to remain smart. And we have to realize that while we have not seen a significant uptick in the total number of hospitalizations, we have not seen a significant uptick in the total number of patients in ICU beds, we have not seen a major uptick in the total number of patients on ventilators, we have also not seen a major downtick. It has been relatively constant for weeks and weeks on end. And so the reality is, as we look at the data, we haven't seen major upticks, nor have we seen major downticks. And because of that, as the healthcare system, because of increased pent-up demand, as more elective surgeries are coming online, as hospitals are doing other procedures that people put off for a little while, we're now beginning to see overall hospital utilization and hospital capacity issues, particularly in specific regions of our state. I say all of that to simply remind the people of Mississippi that this is not over. It's not going to be over until we get through probably towards the end of the year. We're making decisions from a public health perspective which takes into account not only protecting the lives of our fellow Mississippians, but also protecting their livelihoods. We have to get our economy back open. We know that. We understand that. But to do so in a safe, responsible way, it is incumbent upon every Mississippian to adhere to those guidelines. I cannot be more clear about this. We need you to adhere to those guidelines. I know every single Mississippian wants to get back to the way things used to be. Every single Mississippian wants to do the things that you were doing a year ago today. What I'm here to plead with you about today is to understand that while we are in better shape than many, we still have our challenges. We know that one major outbreak in one building or at one event could throw our hospital capacity and hospital utilization over the edge in a specific region. And because of that, we can't just move on as if this never happened. Just because many in the national media are moving on doesn't mean that we can move on. It doesn't mean that the threat is gone. The threat is as real as ever. I want you to know that I continue to take the threat seriously, and I need you to continue to take the threat seriously as well. I know that we're dealing with tropical storms coming across our state. I know that we're dealing with a lot of other things. We're still dealing with the aftermath of the tornadoes. We're still dealing with some of the aftermath of the flooding that occurred in our state. We know that we're going to have more hurricanes in the Gulf in the days and weeks ahead. That doesn't mean that the virus goes away. We have to adapt and we have to overcome. I'm urging you to please do your part. With that, I'm going to turn it over to Dr. Dobbs to give you some more statistics.
Thank you, Governor. And again, thank you so much for your leadership on this issue. As we mentioned, 498 new cases and 20 deaths. A lot of those new cases, the increase was attributable to reporting backlogs, but averaged over, as the Governor mentioned, running in the high 200s. We may see that for another day or two, so just please be ready. If we think about what's going on with coronavirus in Mississippi right now, it's really spreading in the community. And although we have seen a lot of nursing home cases and nursing home deaths, the thing that we're seeing now that's driving transmission is people out and about, younger folks are getting it. This is also coupled with almost like a disbelief that coronavirus is still an issue. And I assure you and want to assure the doubters that coronavirus is still a real threat in Mississippi, not only because it's percolating and can increase at any time, but we are seeing deaths. We are seeing the impacts in our communities when it penetrates into those who are older and are more vulnerable. If we think about what's happened to our long-term care and our nursing homes, what a horrible impact they've seen with so many deaths when you look at the statistics. What you do in the community makes a difference because it will move upstream over time, and I'm worried actually we're going to see additional outbreaks in long-term care as we've seen this sort of bolus of people coming through. Other things to think about from a community perspective is what impacts it has not only on you, but your community. We know that the majority of people who are contagious are asymptomatic. And that's why the masks are so important. It's not so much about you, and it's not a personal decision, but if you're asymptomatic and walking around and you breathe it into the environment, you're going to infect people and not know it. You may never know it because you were never symptomatic enough even to manifest symptoms to get tested. So if we really do want to take care of our neighbors and our family, and we have seen family members who have stayed in home by themselves trying to stay out of the coronavirus, but maybe have one or two family members bring them groceries and stuff, get it and die because the family members didn't know that they had it. So there is still that vulnerability out there. At UMC, they have 2 entire intensive care units devoted to coronavirus. It takes up 1/2 of their total ICU capacity. They've had to move patients into the pediatric ICU and actually created an accessory ICU out of their recovery room because of the number of cases out there. I assure you, it's very real, and when you get sick from coronavirus or some other thing, our health system needs to be strong enough to take care of you. Other things I want people to know, for nursing homes to open up and have visitors, CMS, the Center for Medicare and Medicaid Services, has rules, and part of those rules are declining transmission in the community and a lack of outbreaks and cases in that center. So everything that you do, it's not just about you. It's a small part of helping your community get back to normal when you do those simple things. It's also important when we think about getting ready for fall and getting back to school. If we can get ahead of it and minimize transmission when we hit the fall, maybe that will have an impact and we can minimize the problems that we're going to have very, very soon. So just reinforce, please maintain social distancing. If you stay 6 feet away from folks, if you don't get in groups, and if you wear a mask when you're in public, if we all did that, or even 80 or 90%, we'd be in a phenomenally better place. I mean, we might be like New Zealand, which basically is going back to normal because they did those things. British Columbia, where they did those things. And if we will just choose to do those things and follow the guidelines and the executive orders that are on the books, we would be in a lot better place.
Thank you, Dr. Dobbs. March the 11th was the day that Mississippi learned that we had our first positive case confirmed. That means today is day 89 since we received our first positive case. Everybody in our state is tired of it. Everybody around the country, I'm sure, is tired of it. I can assure you, I am tired of it. However, the virus is still in our communities. The virus can still be spread in our communities. If you look at what we've been able to do in those counties where we've put additional restrictions on, we can show you these counties in which we have put additional restrictions on. The local leaders have stepped up, and that's both elected, business, and otherwise, have stepped up. They've embraced those additional measures. And by and large, we've been able to eliminate those additional restrictions because of the fact that so many in those communities, in places like Scott County, Newton County, Leake County, adhere to the guidelines. And while there is still transmission occurring, it has slowed to a rate that is somewhat manageable. And so we know the things that Dr. Dobbs is asking you to do to take personal responsibility will work. We know that if you'll stay 6 feet apart, it will work. We know that if you'll wear a mask and stay 6 feet apart, it's even better than just staying 6 feet apart. And so I do want to encourage you. I also want to commend many Mississippians who are following the rules, who are following the guidelines. On Friday at lunch, I actually ate lunch at a restaurant for the first time in Mississippi since early March. Everyone in the restaurant, the tables were distanced. Everyone working in the restaurant had on a mask. And I felt perfectly comfortable and perfectly safe. That, by the way, was a restaurant very, very near the city of New Orleans. It is about as close as you can get to New Orleans and still be in Mississippi. And so I just want to say, many Mississippians are making sacrifices. I appreciate you for making those sacrifices, and I encourage everyone to continue to do it, and we'll get through this together. With that, I'm going to turn it over to Director Michelle. We did have a weather event come through. It's coming through as we speak, and I'm going to let him tell you the details.
Thank you, Governor. Yes, as the Governor gave you earlier an update on Cristobal, just real quickly move back through that. Obviously, our third storm of this hurricane season, and on this 8th day of June, it was Mississippi's first storm this weekend. Cristobal, pretty much rated as a mid-grade tropical storm. Did come in, had significant coastal flooding in Jackson County, Hancock, and Harrison County, with our worst surges over in Hancock County. Significant rainfall across the state. It continues to persist as it moves north on a pretty much a general north direction out of the state, and we'll probably see these rain bands continue throughout the rest of the evening into early morning, and probably going to have some rain lingering on as far as Wednesday with this storm. One thing to note, in the same manner that we're asking folks to not take the COVID virus for granted, and we should not, a lot of people tend to take these early storms and not take them for granted. And take them for granted. I just want to reiterate to everyone, as we get into hurricane season, it is still projected to be an active season. This was a mid-grade tropical storm, and you see the effects that it had down on the coast. More significant storms that is projected this season. People continue to need to take precaution and pay attention to emergency warnings. The hurricane forecast for the next 5 to 7 days as we look out, once we get through this system and the rain bands about Wednesday, we hope to have, it looks pretty clear out in the tropics and Caribbean about the next 5 to 7 days. We are watching a few things, but we'll continue to keep you posted as systems develop out there in the Caribbean in particular. I just want to thank Ingalls Shipbuilding for assisting us with our hurricane preparedness guide and translating it into Vietnamese. We got the digital copy on that, so we'll be pushing that out very soon to our population there, primarily on the lower 3 coastal counties in Mississippi, and we still have the Spanish translation that will be coming out very shortly afterwards on that. We did get a acknowledgement from FEMA from Governor Reeves' request for the April 22nd and 23rd storms. We submitted that on Friday as was required, and FEMA has promptly responded back today as acknowledging receipt of that. So now we wait for those 11 counties to be added to the public assistance declaration there. And then finally, the COVID PPE. We had weather stand down yesterday as a result of the storm. We did make 38 deliveries to 38 Tier 1 facilities on Friday, and then we did do specific hotshot delivery Saturday in preparation for the storm to ensure that those facilities had the proper PPE, and then we will resume shipments this week as this weather moves out. Governor, that's all I have at this time, sir.
Thank you, Director Michelle. Again, I want to personally thank these 2 individuals at this table for all of their efforts. They and their teams have been incredible for many days, working around the clock, 7 days a week, and I want to thank them for that. So with that, I'll open the floor to questions. Courtney?
Governor, even since the last time we saw you, there seems to be a renewed conversation about taking down the state flag, changing the design, or using the Stennis flag, for example. What do you say to the people who seem to be very vocal about this issue?
Well, there's been a lot of people that have been very vocal about this issue for a long time. My position has not changed. I spent much of 2019 telling the people of this state what I believed, and that is there is going to come a time at some point, I'm sure, in which the people of Mississippi are going to want to change the flag. And my position is that when they want to do that, it should be the people who make that decision, not some backroom deal by a bunch of politicians in Jackson. And while I know that the last few weeks has certainly increased conversations around that and many other topics, and justifiably so, I believe one of the problems we have in America right now is that people don't trust their politicians. One of the reasons they don't trust their politicians is because politicians tell people one thing during an election year, and then they go out and do something else the very next year once they get elected. I'm not going to do that. I told the people what I believed. I told the people of Mississippi that I believe that there may come a time when that change is determined by the people of our state, and I think it ought to be changed by the people, not by a group of politicians in Jackson.
Real quick follow-up. Given the shift that seems to be happening across the country, whether it be statues or flags or whatever the case may be, not to go back on your word, but would you be willing to have conversations with those who are pushing for this charge who say, can you lead on this issue and calling for the change?
I am always willing to have conversations with individuals that have different viewpoints. I think that is incredibly important to leadership, to reaching out. I've had conversations with a large number of individuals just in the last couple of weeks, and I certainly will continue to do that. I'm very interested in bringing our people together, and that's something that I think is critically important. Clearly, as I've said, as it relates to George Floyd, what happened to him is inexcusable. The fact that a man kneeled on his neck when he was saying he couldn't breathe for 8 to 9 minutes, completely and totally inexcusable. And I think it's a good thing that that individual that did that has been charged, that those 3 individuals that were around him have also been charged now. And they need to be held accountable, because we've got to hold everyone accountable for their actions. That was a personal action taken by an individual police officer that obviously, based upon the video I saw, and again, I believe strongly that every single person deserves their day in court. I believe that George Floyd deserved his day in court for whatever wrongs he may have committed. But he didn't get that opportunity. The reason he didn't get that opportunity is because one man made a decision to take the law into his own hands, and so I don't think that that's right, and I think it's terribly unfortunate. Yes, ma'am.
Hunter Dawkins with the Gazebo Gazette has a question. Hunter?
Governor, how you doing today? Thank you very much, Renee. It was good to see you on Friday, Governor. Question about this too. Another question towards the flag per se. If the legislature and because there's been talk and discussion coming through the legislature, if they actually passed a bill or some piece of legislation and gave you the opportunity to make a decision on the flag yourself, what would your stance be, sir?
Well, thank you, Hunter. It was good to see you on Friday as well. I look forward to getting back down to the Gulf Coast as soon as humanly possible. What I would tell you is I'm not going to speculate on what the legislature may or may not do. We are well past deadlines for the legislature, and I think the rules still matter over there. And so we'll certainly continue the conversation, but I'm not going to speculate on an issue that, quite frankly, can't occur at this time. Emily.
Governor, another question about the flag. Do you think that the Confederate emblem on the flag properly represents present-day Mississippi, not only to people within the state, but to the rest of the world?
Emily, the people of Mississippi in 2001 went to the polls and made a decision to keep the current flag. That was a decision that the people of Mississippi made. Now, had they not done that, then perhaps we could be having a different conversation. But the reality is that is the vote that occurred in 2001. Every single Mississippian has the right to gather the signatures to put that back on the ballot. Every single Mississippian has the right to do that. Should they choose to do so, then we'll have a conversation about that. And it'll be, again, when the people believe it's time to change the flag is when the flag will be changed.
Governor, I was actually asking about your opinion. I'm not asking about the process. I'm just asking what your personal opinion is about that emblem and whether it represents the present-day state of Mississippi properly.
I was elected to be the governor of the state of Mississippi. The people have made their decision in 2001. If and when they want to choose to change the flag, that will be a decision that they can make.
Dave Elliott from WOX has a question. Dave?
Alrighty, thank you, Renee. I appreciate that. Governor, I know this is really a question better directed at mayors or city councils, but I'm curious what you think about what you're seeing across the country right now. Los Angeles, New York, shifting hundreds of millions of dollars out of police departments. Minneapolis actually considering dismantling their police department. What are your thoughts on these, what some people would see as extreme measures?
Thank you for that question, Dave. The measures being taken to, quote, defund the police end quote, are extraordinarily irresponsible. They make no sense whatsoever. We are a nation of laws. We must stand up and protect those who get up and put on the uniform every single day and protect our families. So the notion that we're going to defund the police makes no sense. In fact, we ought to be talking and having a conversation about spending more money on police, more money for training, more money to ensure that that individual policeman has backup, because many times these instances that occur are occurring because you're putting police officers in a situation in which they have fear because they don't have proper backup, and in many instances they don't have proper training. What happened to George Floyd is inexcusable. Inexcusable. But the problem with so many on the far left, and the problem with so many extreme liberals, is they want to do what the former mayor of Chicago said, which was never, ever let a crisis go to waste. The problem with those on the far left is they want to use what is a horrible situation that must be addressed, and they want to utilize it to try to implement every single liberal policy that they'd have ever dreamed of, because they, quote, don't want a crisis to go to waste. What I want is for us to have a conversation with like-minded individuals and those who don't necessarily agree with us about what can we do to look to the future and make Mississippi a better place. What can we do to look to the future and make America a better place? None of this current crisis that we have, and it is a crisis, is unique to our state. We have got to continue having hard conversations, to work together, to make positive change for the future. Renee.
Erica Hensley with Mississippi Today has a question. Erica?
Thanks, Renee. I've got a two-part question for Dr. Dobbs. Can you update us on the number of cases identified through antibody testing? I know it was a small percentage a few weeks ago, but I'm just wondering if we can get an update on that. And also, can you speak kind of generally to how the state is planning to keep up the targeted testing that was sort of initiated by the universal long-term care testing, but now that that's done, if you could just speak to keeping up that momentum with the targeted testing.
Sure. No, thank you. Great question. So far, the state's done 9,140 antibody tests, and of that number, and I don't have how many are positive here, but only about 2 to 3% have a positive antibody. And that's very important because one of the theories that's floating around is that so many people have had it that we have herd immunity and we can get back to normal. And unfortunately, nothing could be further from the truth. We only have, and this number is not a random sample, so it's not really going to be truly representative, but it kind of gives you a taste of the fact that most people haven't had coronavirus and will remain susceptible for the foreseeable future. And you need to get 70 to 80% of folks probably immune before we can even conceive of having herd immunity. As far as the testing goes with long-term care, great effort to get everybody tested. Greatly appreciate the long-term care folks. We're learning a lot. We're still assembling some of the data and trying to make sure that we can make the best decisions going forward. We will absolutely make sure that we have the capacity to test as directed by CMS, all of the outbreaks, and as needed, the employees on a weekly basis. Our current strategy, although not in final phases of development, is going to make sure to focus on those high incidence counties that have a lot of community transmission, and also look at the places that have ongoing outbreaks so that we can make sure that they will, over time, continue to dissipate and we can protect folks in long-term care. One of the challenges, though, is we have to have resolution of these outbreaks for a specific location and no additional cases for 28 days before CMS says you can have external visitation from family, which is really a high standard, but we are committed to try and help our partners in the nursing home community make that standard.
Just to follow up on that, if 9,140 antibody tests have been completed by the state, of the 217,000 total tests that have been completed, which, by the way, means that we're well in excess of 6% of total, and really right at 7% of our total population has been tested. But less than 4.5% of our total tests have been in antibodies. So it's a very, very, very small number. Yes.
Jack from Clearing Ledger has a question.
Governor, can you hear me?
I can hear you now.
Yeah, Governor Reeves, I'd like to know, when you look at the state flag of Mississippi personally, what do you see?
I see a flag that the vast majority of Mississippians voted in 2001 to maintain as Mississippi's state flag. I made a commitment to the voters in 2019 that if and when, and I think that there will be a time when the Mississippians will decide to change the flag. But I made a commitment to them in 2019 that I was going to ensure that if the flag is going to be changed, it's not going to be changed by a bunch of politicians in Jackson. It needs to be changed by the people of our state. And make no mistake, I think that there is no doubt that over the last several weeks that there are people who are coming to maybe a different conclusion than they came to in 2001. There are some that are coming to a different conclusion than they came to a year ago. And so as we progress forward, I think we'll have conversations around that issue and every other issue that is important to my fellow Mississippians.
Joey Barnes with WCBI has a question.
Governor, can you hear me now?
I can hear you now, Joey.
Okay, thank you. And this is, I'll tell you a story and then I'll ask my question. So this weekend I was in Walmart wearing my mask, and there was a gentleman who looked at me dead in the eye and coughed 3 short times. And there's a bit of what I might call mask shaming for people who continue to wear masks as it's been advised. How do you overcome that stigma that may be out there to get people to wear the mask or realize how important it may be?
The scream that I just heard is, while I didn't personally do it, that was what I wanted to do when you told me that story. I wanted to scream just exactly as I heard in the camera. Joey, what I would tell you is, and Dr. Dobbs and I talked about this with local officials this morning, supervisors and mayors across our state. And I absolutely believe the story that you're telling is true. And it's wrong. It's wrong. If people want to wear a mask into a Walmart or into a restaurant or into any other business, then they should be allowed, not only should they be allowed to do so, in many instances, they ought to be credited for doing so. Because the fact is, and we've been hearing from Dr. Burks about this for a long time, the mask that you wear, if it's not an N95 mask, you're really more likely to be protecting your fellow Mississippians than you are to be protecting yourself. Because if you were to breathe or to cough or to sneeze on someone, it's much more likely that you would spread the virus particles if you don't have on a mask, whereas if someone who doesn't have one sneezes on you, even if you have a mask, it is believed that those particles can get you. So everyone out there that is choosing to wear a mask is actually doing something good for their fellow Mississippians. And so what I would say, Joey, is congratulations on wearing a mask. I know that it's kind of a difficult situation. And look, part of it is Part of it is the fact that we're on day 89 of this conversation. People are tired of it, and so they want to pretend like the virus is no longer around. It's one of the things that is frustrating to me about where we find ourselves, for instance, in the George Floyd matter. You know, every liberal nationally has decided that this is a reason to do every liberal public policy initiative, many of which have been proven to not work. In fact, I get emails now from those who say we ought to expand Medicaid because of this factor. Well, the reality is, while that's a liberal policy idea that, in my view, is not good for the state of Mississippi, we need to focus on doing what's right for our state. We got to fix excessive force by police when those occur. We've got to provide better training, and we've also got to provide support and recognize that not just because one policeman makes a bad decision and makes a mistake, doesn't mean that every policeman is bad. In fact, nothing could be further from the truth. The vast majority of Mississippi policemen and troopers and others who get up and put on the uniform every day, they went into that field because they wanted to help their communities. And the people, in large part, who are wearing masks are doing so to protect themselves, but they're also doing so to protect their neighbors. And so one of the things that I'm concerned about, and I just want to be honest with the people of Mississippi, one of the things I'm really concerned about is I've seen the huge protests that have occurred in our state and around the country. There are protests that were, in many instances, certainly in our state, and I commend those who organized the protests, they were done in such a way where they were peaceful. We had virtually no violence in Mississippi, and I'm proud of Mississippians for that fact. But I'm also concerned that when that many people get in areas that are that close together, that there's going to be community spread of this virus. And you know, a lot of the protesters, particularly around Mississippi, were younger people, probably more healthy, probably less susceptible to death by the virus. But my concern is, what if those individuals protested on Saturday and then went and had Sunday lunch with their grandmom on Sunday? And so one of the things that I would recommend is that if you were at a protest on Saturday in Mississippi, I want to thank you, congratulate you for doing it in a peaceful way, but I also want to encourage you not to visit with your grandmom or anyone else in Mississippi that is in that vulnerable population, because it's very possible that you could have contracted the virus and that you could then spread it to someone who could have serious, serious, serious consequences. You know, we had a call with the coronavirus task force earlier today, and this is one of the graphs that they handed out. These three pieces of this pie chart, which represents approximately 81% of the pie, represent people over the age of 65. The mortality by age group, less than 0.14% of the total deaths in America, this is not unique to Mississippi, this is in America, is by those that are less than 25. I would argue, and I don't have the scientific data to back it up, but I would argue that more than 0.14% of the deaths have been caused by those under the age of 25 who have spread the virus to those in the more vulnerable categories. And so again, we are, not only are we not out of the woods, we're nowhere near being out of the woods as it relates to COVID-19. We've got to do everything we can to be smart. We've got to make sure that we make good decisions, that all of us do the right thing. Gordian?
Looking at the calendar, Memorial Day was 2 weeks ago. Is there any concern that community spread, social gatherings contributed to the higher numbers that we're starting to see now?
Yes. We've had persistent numbers that have, and community spread, so it's hard to pinpoint exactly, but certainly that is a major concern. But the other thing is, we know that when we have sort of like spread broadly, it takes a couple of transmission cycles to really hit the vulnerable groups. And so I'm really concerned about a second wave of infections in the long-term care and nursing home settings. So yes, very concerned. We did see a shift from outbreak-associated infection to more community-based, and that could be a big piece of that.
Yes, sir.
I'd like to go back to the question Emily asked, because you pretty much skirted around the question when asked about your personal feelings about Mississippi flag and whether or not that Confederate emblem is representative of today's Mississippi. Again, is that flag representative of today's Mississippi as you look at the many constituents of different colors, different faith that you that you serve? Is that representative of Mississippi?
Well, Gerald, what I would tell you is exactly what I told Emily. The people of Mississippi made a decision in 2001, an overwhelming decision to maintain the flag. In 2019, for months and months and months and months on end, I was asked this very same question, and I gave exactly the same response that I'm going to give you today. If and when Mississippians decide that they want to change the flag, and I think at some point they will, then it ought to be the people of Mississippi. You know, when we look at this, and while these two things don't necessarily conflate, I do think it's important. When we look at the coronavirus, and I think about the African-American pastor from Natchez, who I didn't even know that he was having church services until one of the members of the press asked me about it. And I told you all that I didn't believe that that government could shut down churches. But I did believe that as the governor of the state, I could sit and pick up the phone and call pastors and ask them and tell them my views on what would be safe for their flocks. And I believe that most pastors would come to the conclusion that they did not want to put their flocks in danger. I called that African-American pastor in Natchez, and he was, when I initially spoke to him, he was very, very adamant. He said, "Governor, I appreciate what you're calling, but these local government officials, or you cannot shut down my church. Government cannot shut down my church." And I said to him, I said, "Sir, I agree with you. I don't believe government can shut down your church. But I'm calling you as a fellow Mississippian and asking you to protect your flock." And as you'll recall, within 48 hours, he came, he sat in that chair right there. He made it very clear that he did not vote for me last year. And then he said, "As long as the government's not telling me that I have to shut down, if you're asking me to do what you think is right for our people, then I'll do it." Well, I firmly believe that if, in fact, politicians in Jackson decided that they were going to do something that was against the will of the people, that we would have some seriously, seriously upset Mississippians, and quite frankly, justifiably so. If, however, we as a people come together and decide that it's time to go in a different direction, then I think the outcome and the long-term bringing people together will be very different. And so that's the reason that I have repeatedly said, and I'm going to continue to say, that if the flag is going to change, it should be changed by a vote of the people. I'm not going to, that's my position. It's been my position. It's continued to be my position.
Governor, I'm not
Yes, sir.
debating with you on that, but the question was, do you think, I'm not asking about changing the flag, removing the flag, adding a pin, anything about that. Is it representative of today's Mississippi?
Gerald, I've answered this question 3 different times. I appreciate your question, but we're going to move on.
Governor, with respect, you didn't answer the question. The question was, is it representative of Mississippians? If it's not, it's not. If it is, Governor. All you have to say is, it is or it isn't.
Renee?
Hunter with Gazebo Gazette has a question.
Governor, I've got a double question for you and Director Michelle. Thank you very much, Renee, for answering. Also, but what I was going to ask was the first question, because of the storm this weekend, have the supervisors or anybody from the coast counties contacted you for assistance? And then the second question, really directed for you, Director Michelle. Was there PPEs provided to the shelters, or was it just for the emergency centers? Thank you guys very much. Appreciate it.
Thank you, Hunter. As you know, I was on the Gulf Coast the better part of all weekend, and so I was actually in the Harrison County EOC on Saturday afternoon. I was in Hancock and Jackson and Harrison on Friday afternoon. So we've maintained very, very close contact with the emergency management coordinators in each of those 3 counties, and we'll continue to do so.
And with regard to the PPE, yes, all of the emergency managers across the state, to include those lower 3 counties, have PPE sets for shelters. As the governor, though, reported earlier, none of the shelters on the coast were reported having opened. We did have 2 in Wilkinson County, and we did have 1 in Marion County, a non-congregate shelter, and all of those EMA directors did receive PPE to support shelter operations should they have been needed.
I think Dave from WLOX had a question.
Good.
Dave?
Okay, thank you, Renee. I appreciate that. Governor, I'd like to point out that lawmakers do things against the will of people all the time. It's called leadership, but a question for Dr. Dobbs. Some are saying that the number of tests given, the increased number of tests, is really what is behind more and more numbers being revealed in terms of positive cases. Others say, no, it's the reopening. Maybe it was premature, maybe it was too broad. Is the truth somewhere in the middle on that, or what's your read on that?
Well, I think that certainly the increased number of tests has increased the number of people we're finding, and we're seeing, younger folks who have less symptoms, and that's very important to do so. Our deaths are not dropping and our hospitalizations are not dropping. So there's not a single value that we can use to define this. We did see a dilution in the percent positive at the state lab when we started testing the nursing homes, because our percent positive there was significantly lower than the average, which has been about 9%. So it's a combination of effects. But if we look at the mortality, if we look at the percent hospitalization, and then if we look, but also at the numbers, it's still out there. As far as like the reopening, I would like to say that the steps that were laid out in the reopening are very prudent steps. And I think if people will please read the executive orders or go to the health department website and look at how we outlined it, there are safe ways for us to engage in our communities where we can get back to some sort of normal, where we can be outside and everything. Oh, I will say one thing. I'm so proud of Mississippians for buying out all the bicycles. I hope that's something we can build on in the future, and to get healthier, because COVID's not going to be here forever, but obesity and heart disease will be. So I look forward to transitioning to a pro-bicycle platform.
Don't you just wish you had a few more hours every day to ride your bicycle?
I do.
I know you do. Cornan.
Governor, the driver's license station is reopening today. I know that you all had said, look, it's not going to be perfect. The commissioner said, don't everybody come at once, but probably as expected, we are seeing lines around the buildings. What do you say to those folks maybe who are in that next set of alphabetical order, who maybe are just already frustrated that are going to have to wait in line in hot temperatures, it looks like, tomorrow?
Yeah, well, first of all, I want to congratulate Commissioner Tyndall. I saw that he was out and about. He was actually at many of the DMV locations today. He was helping individuals. We tried to plus up staff at the DMV facilities, but we've been very clear from the beginning. Let's face it, the DMVs did not run very efficiently before COVID-19. They've been closed now for weeks and weeks and weeks on end. We know that there's going to be growing pains in getting those reopened. And so I just have to ask the people of our state to bear with us as we try to get through that. Remember, if you are renewing your license, you cannot do it at one of the locations that you go to. Renewals are done online. And so that's about 82 to 83% of all transactions that are done by DMVs. And so if those 82 or 83% will go online at www.dps.ms.gov and do their renewals, then that will take a large percentage of the overall DMV applications that they go through and put them in a spot where they're done online, and then that reduces the number of people that have to go in. And so We've taken significant measures to make changes, and we'll continue to do that. But we're certainly not where we need to be, I can tell you that.
For those without internet access, is just a public library the best option, or is, I don't recall, I meant to ask that the other day, but if they don't have internet access, are they gonna just have to get to somewhere where they can?
Yeah, I think that's correct. I mean, and obviously, this is a short-term approach to try to get those who are weeks and weeks and weeks behind the opportunity to catch up. That's the same is true. I mean, we don't envision long-term that your last name beginning with A means you come on Monday. We want to get away from that. But just this initial first push, as we try to get more and more folks on, that was determined by the Department of Public Safety that was the most appropriate place to do so. Emily.
The legislature voted a few years ago to change one state symbol. They voted to put "In God We Trust" on the state seal. That was done without a vote of the people. How come it was okay for the legislature to do that, but not to deal with the flag?
In that instance, the people of Mississippi had not directly voted on exactly what our state seal would look like. In addition to that, I think it's widely viewed that somewhere around 90% of Mississippians believe that the addition of "In God We Trust" to our state seal was the right thing for our state to do. And so, but the primary difference, Emily, is the fact that the leaders in 2001 made a decision to put it before the voters in our state. The voters made their decision, and until the voters change that decision, it is my view, which is exactly what I told the voters in 2019, that if it's going to change, it ought to be changed by a vote of the people.
As you point out, the way it got on the ballot in 2001 was that the legislature voted to put it there. It was not done through the initiative signature gathering process. Would it be acceptable to you if the legislature voted to put this up for vote of the people, and if it did not come through the signature gathering process?
If the legislature decided that that's the approach that they wanted to take, I would not stand in their way. But I do want to point out that every single Mississippian has the ability to go get 120,000 votes, of which I think they probably could do, or 120,000 signatures. If they want to put it on the ballot, then they have the ability to do so. I believe there's what's the initiative that's on the ballot this year? A marijuana initiative, I think. We had an initiative in 2015. We've got one in 2020. So at one time, it was virtually impossible to get something like this put on the ballot. Nowadays, it's not nearly as difficult because of the communication that individuals can do with social media and online, and encouraging people to get involved and engaged. And I will tell you, I think there are a lot of people that are very passionate about this issue, and that's certainly an opportunity and an option that they have. Yes, ma'am.
Hunter with Gazebo Gazette has another question. Hunter?
Thank you, Renee. Thank you, Governor. I'm sorry to ask you again, but what is your opinion? And I know I've read a few things on this, but I kind of want to hear it directly from you about the extension of the legislature, if they decide to extend the session, or if they have already ruled against that. I'm just trying to see what your opinion of that would be.
Well, thank you for the question, Hunter. My opinion is the same, I believe, as the vast majority of Mississippians. I don't think that Mississippians sent their legislators to Jackson to have a full-time legislature. And I think it's a bad precedent to set that going forward. And I don't think it makes any sense whatsoever for the legislature to vote for themselves to stay in session until the end of the year. That makes absolutely no sense. It's unprecedented in Mississippi history, and I don't think it's a good idea. But I'll also tell you, Hunter, that these are decisions that the legislature makes internally. This is in continuing resolutions, and this may be the reason they're doing it. The governor doesn't even have the ability to veto it. And so this is a decision that has to be made internally. And so for it not to occur, then at least 18 senators have to stand up and vote and say, our people did not send us to Jackson to stay in session all year long. And I think if 18 senators will do that, then this resolution will not pass.
You've repeatedly talked about the will of the people on the initiative process. The people of Mississippi rejected a personhood amendment the same year that Phil Bryant was elected governor. Yet you and others have continued to push restriction on abortion. How do you square your position on that issue that the voters voted on and your position on the flag?
Well, if you look at the actual personhood initiative, you'll recall that late in that process, then Republican Governor Barber actually came out in opposition to it because of some of the actual specific language in that particular initiative. And so I am a pro-life conservative. I believe that abortions are murdering babies, and I think that's something that we ought to do everything in our power to minimize, if we can't, based upon the Supreme Court, eliminate all abortions. That's what we've tried to do in Mississippi. We've tried to pass lawful laws that would adhere to Supreme Court precedent, and while at the same time protecting the lives of as many Mississippi babies as is possible. Seeing no more questions, thank you all very, very much.